This is the first of many mouth diagnostics for medical doctors called MDs for MDs. By now you've probably heard of the gut brain, how our stomach biota can affect our health in ways we didn't even know. But do you know about the mouth brain? The mouth brain has over 50 different functions and can affect everything from digestion to mental health. Our goal is to have every doctor worldwide learn to do these mouth-brain tests and every medical school to teach them. Our mission is to create a mouth medicine department in every medical school in the world. And we're going to be able to do that with your help. These guidelines are medically sound, but as simple as your ABCs. So let's begin. Maxillary dysmorphogenesis. The maxilla is the criminal, and the mandible is the victim. Measure the maxillary diameter and maxillary depth. Recognize maxillary dysmorphogenesis. We can all learn to recognize facial intergenerational palatial shrinkage or maxillofacial de-evolution. Our human maxillopalatine bone complex is shrinking, with dire craniocervical and craniofacial consequences that impact our airway and our alignment. We have published and documented the 10 biological reasons why our upper palates are shrinking. This is a serious overlooked cause of many major medical issues. Molar deficiency. A lack of molar development caused by the tongue and cheek muscles disturbing molar growth. A molar deficiency creates the basic bad bite score. Chart the bite score. 1. In millimeters, measure the vertical tooth overbite. 2. Measure the horizontal tooth overjet. 3. Measure the midline deviation. 4. Add 1, 2, and 3. This is the bite score. A low bite score is desirable, since paleo people had a bite score of close to 0 or 1 or 2, according to all our ancient skull bite analyses. People who have head and neck airway and pain issues have bad bite scores, which means deep bites of 5 to 10 millimeters, very posterior bites of 4 to 5 to 10 millimeters, and often a midline deviation of 1 to 4 millimeters. Bite scores of 8 or more up to the early 20s are very bad. These patients are sick structurally and will become unhealthy patients. You must know your patient's bite score. Mandibular dysfunction. We will take the jaw ROM or jaw range of motion score. Measure the vertical or maximum mouth opening, MMO. This score can be 20 millimeters to 65 millimeters. 20 to 40 is pathologic. 45 is okay. 55 to 65 is excellent. Measure the full anterior to posterior or horizontal jaw range. We call this the overjet plus the protrusion score. Add 1 millimeter for the width of your front tooth tip. This horizontal score ranges from 5 to 15 millimeters. 5 is a bad score. 10 to 15 is a good score. Measure the total lateral jaw joint movement. This varies again from a low of 10 millimeters to a high of 30 millimeters. Add these jaw range of motion scores all together. A bad jaw range of motion, or JR, is 35 to 50. A good jaw range of motion is 75 to 100. The jaw joints are double joints. So they are really 4 joints interacting with an often maloccluding biting joint and the 2 temporal cranial bones. Thus, the jaw joints are the most important and most complicated joint systems in the body. Section D. Myofascial distress. Manual diagnostics or muscle diagnostics, which evaluate myofascial distress in 10 jaw, head, neck, and shoulder muscles. Learn how to do manual diagnostics or muscle diagnostics. Dr. Osler insisted that his students learn manual diagnostics. Modern doctors have lost the art of manual diagnostics. By learning how to quickly palpate 10 muscles, you will know your patients better. There are 4 jaw muscles, all are paired muscles. Medial pterygoids, lateral pterygoids, the masseter, the temporalis. Then do 4 more muscle groups. Both the neck muscles, the occiput area, the trapezius muscles. Then turn the head and palpate the sternocleidomastoid mastoid muscles, SCM. And finally palpate the digastric muscle under the chin bone. Remember this, all muscles work in harmonious myotatic units. When the jaw muscles are stressed out, the neck muscles get stressed out too. When jaw muscles are stressed, the airway muscles tighten up and you snore. When the jaw muscles are stressed, then the throat muscles get symptoms of being too tight, such as throat clearing and dry cough. You see, everything is interconnected by myofascial chains of myotatic units. We are one continuous myofascial distress system, from the trigeminally powered teeth to the tailbone to the toes. Malfunctioning deglutition. Tongue and swallowing problems in tests. Diagnose the tongue. This will give you several neurological clues. Look for malfunctioning deglutition. A bad swallow is most often overlooked. Look at 1. Tongue extension. Deviation, which can mean a tumor impacting tongue neurology. 2. Is there a coating on the tongue? What type? Fungal coatings are usually white. Heavy smokers have darker coatings. A healthy, clean pink tongue is what we want. 3. Is there a tongue tie? Ask the patient to stick their tongue forward. If it barely passes the lower lip, then you know that there's a tongue tethering problem. 4. Observe scalloping on the sides of the tongue. Scalloping on the sides of the tongue highly correlates with future or present obstructive sleep apnea. Mouth Diagnostics relate to the visible size of the aperture above the tongue when the patient says, ah. 5. Do basic speech tests. Have patients say, testing, testing. Observe the position of the lower anterior teeth vis-à-vis the upper anterior teeth. Measure that new functional medicine bite score or forward jaw posture during speech. This is an important but subtle clinical observation for all doctors to learn. It is usually a very good bite score posture, since speech is an airway function, and a good airway bite should be closer to an edge-to-edge bite. Closer to being 0 to 2 millimeters for the overbite, the overjet, and the midline deviation. Watch your patient's tooth-jaw posture carefully during speech and make a mental note of the brain-speech jaw posture. 6. Do a bite posture airway test. Tell the patient to bite on their back teeth and inhale through their nose. Feel the bad bite airflow. Have them bite the tip of their thumb. This brings their jaw forward into the nearly edge-to-edge bite posture, the neat or paleo posture position bite. Ask if their airflow gets better. Many patients sense or feel an immediate improvement or an increase in nasal throat airflow due to moving the jaw to the paleo posture neat bite. The tongue and hyoid bone move forward, also moving these muscles forward and opening the airway. Now, we heard breathing is important. In fact, some people correlate breathing well with living well. 7. Remember, the tongue is innervated by 5 cranial nerves. In the best-selling book, The Brain's Way of Healing by Dr. Norman Doidge, Norman reports on the Pons machine for brain neurogenesis, which electronically stimulates the tongue with the Pons machine, which stands for Portable Neurologic Stimulation. Amazingly, this tongue stimulation creates new brain cells. This was built on the research of the late Dr. Bak Irita, whose father had had a stroke. Electronically stimulating the tongue is a way to create new brain cells and new brain pathways for stroke or brain injury patients. Mouth dermatology, which is gum disease and malodor diagnostics, or bad breath. Mouth dermatology, or pervasive gum disease, are serious causes of whole body inflammation and potential organ and placental infection. We still do not understand why every heart institute and every fertility institute in the world does not have dentists on their team. This is gum disease, which is a massively overlooked major cause of whole body inflammation and infection that you must detect, understand, and be aware of. In advanced gum disease, you can smell the rotting periodontal flesh. There is a subordinate mouth dermatology, MD, called malodor diagnostics, and there are actually new clinical malodor machines to do breath diagnostics. We recommend watching this video and practicing 20 times to master these tests, but you or your staff can do these tests in a few minutes. This will give you the CPR Mouth Diagnostics advantage. CPR stands for Clinical Pattern Recognition. CPR is very valuable mouth medicine clinical data, so you do not ever have to tell your patient, "We do not see anything wrong with you, so we will refer you to psychology or psychiatry." Mouth diagnostics for medical doctors, or MDs for MDs, creates another level of patient evaluation. In fact, we're teaching you here how to develop a totally correct, factual, and legitimate way to possess an unfair clinical advantage as a mouth-brain diagnostician. This is why Dr. William Osler said that the mouth is the mirror of all disease. Please share this first 6 mouth-brain diagnostics with your family and friends, and share them with your family physicians. Wait until we tell you about maternity dentistry, metabolic disruptors, myorespiratory distress, myopostural distress, metal distress, malocclusion development, microbial diseases, including microform diseases, mycotic diseases, micronutrient and mineral deficiencies, and an alternative to wisdom teeth surgery for future generations in doing molar decrowding called the middle molar method. And of course, macronutrient design and microbiome dysbiosis. And of course, macronutrient design and microbiome dysbiosis. And looking to the future, maternity designing, planning ahead several generations to be planning and creating super healthy children called paleo moderns. Imagine what we can do working together.